Coronavirus it's just throwing the world upside down. And we're seeing this as a central part of this election, the political debate surrounding the coronavirus. Unemployment has skyrocketed. Many are still afraid to leave their homes. Unfortunately, over 100,000 Americans have lost their lives to COVID-19. But could these financial incentives for Medicare-related COVID-19 deaths be inflating the numbers? Could the numbers be inaccurate, and could that be fueling political debate? Joining me now to talk about the incentives for coronavirus reporting deaths from hospitals is Congressman Blaine Luetkemeyer. He represents the 3rd Congressional District of Missouri. Congressman, welcome to the program.
Thank you, Tony. Good to be with you this afternoon.
Now, last week, there was a hearing on this topic, and it was interesting that you asked it because I was watching that, and in fact, I had a personal experience with this with a relative that recently passed away who had been tested for the coronavirus about 6 to 8 weeks prior to his death, and his death was actually not prompted. He had an accident, but on the death certificate, it listed COVID-19 as the reason for death. And that began me asking questions, which you have repeatedly asked. Why are we getting, I should say, skewed numbers based upon these financial incentives for reporting these COVID-related deaths or unrelated deaths?
Well, I think we are, Tony. I think, back in the first part of July, we had a hearing with my select committee, and Admiral Gerwar was there, and he is the Deputy Secretary of HHS, which is the entity that actually makes the payments on this. And I asked the question at that time because anecdotally I'd had a lot of people tell me, like you had just described, that people were in automobile accidents and then they were listed as dying from COVID. People had heart attacks and they were listed as COVID because whenever they pass, there is a test done to see once if they had COVID in their system. And if they did have COVID, then it's listed as a cause of death. And as a result of that, in the CARES Act, which we passed back in, March, there is a plus-up of 20% for hospitals to be able to charge more if they give services to somebody who has COVID. The intention there is to reimburse hospitals for the extra PPE and all the extra procedures and precautions they have to take when they come in contact with a coronavirus patient. It's not there to post-death be able for them to be able to say that they can charge somebody for having attended to them for their COVID needs, which they didn't, obviously, if it was an auto accident or heart attack. And so I asked the question again the other day because I didn't get a chance to finish up my questioning. I only get 5 minutes when I'm in those committee hearings, and that would be the last question that I was able to ask, and I didn't get the follow-up question, which, okay, what are you doing about it? So I thought, well, I'd check with Dr. Redfield and just double-check and see what he was saying, because he's the director of the CDC. And so I did, and I asked the same question of him, and he admitted the same thing, that, yes, those numbers are inflated. And I can tell you, as I stated in committee, that the governor of Colorado, he did a study of his numbers and found that 12% of the deaths were incorrectly attested to COVID-19. I can tell you that we've also are aware that Pennsylvania's got a couple hundred, as well as Texas now, just this last week, has found 225 people that were miscategorized as dying from COVID. So there's a perverse incentive for the hospitals to be, while we want to pay them for their treatment and their expenses that they are involved with when they treat people with COVID, to go out and actually tell people that their loved one died from COVID, which they didn't, and then be able to make money off that. To me, that's a disingenuous way and manipulative way of going about this, and quite frankly, perverse in how they go about this. So that's the reason for the question. It's a little background on what's been going on.
Well, Dr. Deborah Bricks, who is a part of the coronavirus response team at the White House, she has been quoted as saying that she believes that the deaths are being overcounted by as much as 25%. Now, just so folks are clear on what we're talking about here, these are Medicare patients. They would receive normally $5,000, but if it's a COVID-19 under the CARES Act, if it's pneumonia, it's $13,000. And if the patient ends up on a ventilator, then it goes up to $39,000 in terms of the reimbursement that the hospital would get. So clearly there's a monetary incentive for the hospitals, but this is now factoring into, and I don't think the hospitals are doing this intentionally, but this is a politically charged issue. When we see these numbers going up each and every day, number one, because we're doing more testing. I mean, I'm 2 weeks recovered from the coronavirus. I did the test, so that was reported. I was among those numbers. And as you see these numbers going up, it's becoming a major political issue in an election year.
Yeah, I mean, it is. You know, the media is making something out of the number of cases of positive tests, which is fine. We need to know that, but I think they're not talking about the percentage of hospitalizations, which goes down because we're finding so many positive tests that are asymptomatic individuals. And then the deaths, we found that and then this is something that a lot of people don't know, and that we don't talk about it very much, and especially the press doesn't talk about it, is that they even have some drugs now that actually works. They've got some processes and procedures that they're doing now to minimize some of the effects of the virus and able to get people out of hospital and save lives. And as a result, the death rate's actually going down instead of going up. And so it's it's a little disconcerting to get the wrong information out here. Everybody says, let the science drive what's going on, let the data drive it. Well, if you don't have good data, it's incorrect. And it's, you know, the governor of Colorado says 12%. If Dr. Burke says 25%, let's just shoot in the middle there, about 20%. So 20% of the 150 to 160,000 deaths are not there. So now we're overestimating by 20% the deaths. That's pretty significant, I think, and I think it's something that we need to be getting a handle on here, because if we're going to base a lot of our decisions on the number of deaths, number of cases that test positive, we need to understand where that data comes from and where it's going. And to me, it's very important.
I think so, and I think, you know, when you're potentially skewing that data with financial incentives coming from the federal government. Now, I understand, Congressman Luetkemeyer, the whole rationale. I mean, there's additional costs related. My daughter is an ER nurse that works with the COVID patients. I understand the extra precautions they have to take, the extra equipment it costs, and all of that. However, you know, when you see someone, and, you know, I've seen a couple of these cases and up close and personal, and as you said, you've heard these stories. I think it requires further investigation, especially since these numbers are being exploited for political purposes.
Yeah, and I think, you know, our job is to be, you know, make sure those dollars are used in the right way, that we're accountable for them. And so what I've done is I've got a letter sent out as of yesterday morning to the doctors Gerwa and to Dr. Redfield, and say, okay, you guys have testified under oath in my committee that you believe that there's some funny business going on with these numbers. They're being overstated. So what are you going to do about it? Mm-hmm. Because it is the taxpayer dollars that are being used here, manipulated, and my job is to make sure that they're not being, you know, taken advantage of. People, you know, taxpayer dollars are not being used inappropriately here. So, you know, I think that's where we're going to. This is my next step. I think when you have two people that stature testify under oath that there's some funny business going on with these numbers, I think we need to take another look at it and continue to investigate. So that's what we intend to do.
And I actually trust Dr. Redfield. I've had him on my program before, and I think he's a straight shooter. He's going to answer the questions that he's asked. And so I think you should get a solid answer from him and follow up. And I'd be very interested to hear what that is. But Congressman Luetkemeyer, I want to ask you this question. As you have now been in multiple committee hearings discussing this issue, you've you're right there on the front row. Is the issue of the coronavirus, COVID-19, has it become more of a political issue than a health and medical issue in terms of the focus that's being placed on it?
Yeah, I really think it has, Tony. And you're correct with Dr. Redfield. I had a long conversation with him on a personal basis before the committee, and he's very open and very honest, and he's a straight shooter. But to answer your question, I think we've seen after the initial 6-week period here when we were all concerned about a virus we had never heard of or seen before. What do we do? How do we react? What kind of precautions do we need to take? What medications work against it or don't work against it? I mean, we were in limbo here, and so everybody was pulling the wagon the same way. And then suddenly, after a while, everybody kind of figured out that, okay, well, it really affects seniors mostly. Other people can get it, but don't necessarily get quite as sick or as deathly sick. Young people get minimally sick, and how it's transmitted and what drugs do or do not work. And so they kind of got a handle on where we're going with it. And now the farther we get, the more politicized we get. And I tell people, the key word is always perspective. To keep in perspective, here in Missouri, we still have lost more people to the common flu this year than we have to COVID-19. The medical professionals keep telling us, your child is in greater danger going to school and catching the regular flu than they are COVID-19.
Yeah.
So it's a perspective. You have to keep it all in perspective.
Yeah, and I think the media is exploiting it, and I think these inflated numbers only add to that. Congressman, thank you for joining us, and thanks for bringing light to this one aspect of the coronavirus.
My pleasure, Tony. Thank you. Take care.
All right.
All the best.
Congressman Blaine Luetkemeyer from Missouri.